Hi, everyone. So I have been a social work educator for about 10 years and a clinical practitioner and supervisor for about 25. And one of the things that I commonly hear from both students and from practitioners that I supervise is, why is it so hard for my clients to change? Why do my clients keep doing the same thing over and over again? Why do my clients keep engaging in self-destructive behaviors? What we used to call self-harm, now we call tension reduction behaviors. Why is my client so reactive? And why is it so hard to help them calm down? And so the answer to that is trauma. And what we're seeing really are the consequences of traumatic exposure and sometimes early attachment disruptions. So the point of this class is to really think about what we're seeing in clients from a trauma-informed clinical perspective. This course is an advanced clinical interpersonal practice elective. It builds on the foundation years of IP and some of the theories that are discussed in the interpersonal practice track courses. We focus on understanding the range of traumatic experiences that human beings encounter, but we mostly look at the biological, the interpersonal, and the psychological responses to those experiences for people across the lifespan. So we look at children, adults, young adults, as well as elders around trauma exposure and responses to traumatic exposures. We focus a lot on assessment, clinical assessment, and also some of the common interventions, both strongly evidence-based interventions as well as some of the newer interventions that seem to be working, but that maybe we don't have a lot of empirical evidence for them yet. So we talk about all of these. Some of the topics we look at are neurobiology and trauma and affect regulation. And so when we talk about why do my clients keep engaging in these behaviors, well, some of them are really biologically driven, and that traumatic exposure changes our brains and our hormonal systems, and therefore how we engage and respond to situations. We talk about the stages of trauma treatment and the importance of stabilization and how we help clients stabilize. We come from multiple theoretical perspectives: psychodynamically informed and relational approaches, behaviorally informed interventions, including psychopharmacology, cognitive and narrative interventions, family-level interventions, and the intergenerational transmission of trauma. So often we see families where there have been long histories and generational histories of traumatic exposure and abuse as well. We also talk about strength, resilience, and post-traumatic growth. We talk about all of these within a cultural context as well. We talk finally about secondary traumatic stress, how difficult it is for us as social workers to listen to trauma-saturated stories over and over again, and how we can cope with that so we don't also end up experiencing some of the same symptoms that our clients are experiencing as well. And that involves also self-care. So the class combines a lecture, discussion, as well as case discussions and presentations. So we really try to bring it to the ground. What are you seeing in practice, and how can what you're learning in this class inform what you actually do in practice? The person who teaches this course is a highly skilled and experienced clinical social worker. This class was offered last year, and so this is the second year that it's offered, and I believe that it's offered on Thursday nights. Your assignments are to do an assessment paper and also an intervention paper to really consider who is this client and why do I think these interventions would be most helpful with this person. Okay.